Hello everyone. This presentation is brought to you by Nolan's Family Pharmacy, located at 2513 East Chester Drive in High Point. At Nolan's Family Pharmacy, we take your health and wellness in our hands. We have been proudly serving the community of High Point and surrounding neighborhoods since February of this year and is overwhelmed by the support that we have received so far. We offer free prescription delivery encompassing a 15-mile radius, immunizations, pre-assembled compliance packaging systems to encourage adherence to medications, talking labels for the visually impaired, and free consults with a pharmacist or wellness coach. Now, let us talk about diabetes. Diabetes is a chronic but manageable health condition that occurs when the blood glucose, otherwise called blood sugar, is elevated in our bloodstream over a prolonged period. There are two main types of diabetes that we will discuss. These are type 1 and type 2 diabetes. Type 1 diabetes occurs when the body does not produce insulin, while in type 2 diabetes, the body may produce insulin, but just not enough of it, or for others, our body cells just does not react to insulin very well. This is sometimes called insulin resistance. Insulin is a hormone that is made in the pancreas. Our body uses insulin to extract glucose from the bloodstream into our body's cells, where it is used for energy. If our body does not have sufficient insulin or does not use insulin well, this causes a buildup of glucose in our bloodstream, which could lead to diabetes. If you are diabetic, you are not alone. According to the CDC, approximately 10% of the US population is diabetic, and another 34% has pre-diabetes. The good news is that diabetes is manageable and can be managed by diet and exercise, oral and injectable medications, or a combination of both. Your doctor will decide which is best for you. There are a number of tests that are available that can be used to diagnose diabetes, with the most popular being the A1C test. This test gives your average blood sugar levels over the past 3 months. As seen in this slide, anything below 5.7 is considered normal. There are quite a few risk factors for getting diabetes. These include having a family history for the illness, being overweight or obese, history of gestational diabetes, and race or ethnicity, as seen in this slide. Diabetes, if not managed well, may cause harm to a variety of organ systems. These include the heart, kidneys, eyes, gums, and skin. Now, let us take a look at ways to keep active with diabetes. Exercise allows our bodies to be better able to use insulin. Try working towards 150 minutes of some kind of physical activity each week. Exercise also provides lots of healthy benefits to our bodies. It helps us burn calories and lose weight, makes us sleep better, lowers our blood pressure and cholesterol, lowers stress levels, gives us more energy, and helps us to build strong muscles. This slide gives ideas on ways to keep active, such as biking, yard work, hiking, brisk walking, or jumping. Remember to discuss this with your primary prescriber first. Now, let us take a look at eating well with diabetes. On this slide, you see a picture of the diabetes plate. The diabetes plate gives a simple guide on the portions of food to consume and helps lessen carbohydrate intake. Remember that it is the carbohydrates that we eat that are broken down in our bodies to form glucose, which is also called sugar. Start with a 9-inch plate. Fill half with non-starchy vegetables, a quarter with lean protein, and a quarter with carbohydrates, or you may even choose to skip the carbohydrates and double your non-starchy vegetables. You can also add a 0-calorie drink. Non-starchy vegetables include carrots, broccoli, asparagus, mushrooms, and tomatoes. Lean protein include fish, lean pork, lean beef, and turkey. Carbohydrates include popcorn, brown rice, beans, pumpkin, oatmeal. You can also add a 0-calorie drink such as water, club soda, or unsweetened tea. It is important to know your carbs. There are 3 main types, which include starches, sugar, and fiber. When choosing carbs, be sure to stay away from white rice, white bread, etc. Choose whole wheat instead, such as whole wheat flour, whole wheat bread, because these contain fiber, which we will discuss later. The second type of carbohydrates are sugars. Sugars cause the biggest jump in blood sugar, example, candy, soda, honey, syrup, table sugar. The third type of carbohydrates are fibers. Fiber is found in plant food and passes through our body without being digested. It also makes us feel fuller for longer and reduces blood sugar and cholesterol. Now, let us take a look at a few healthy substitutions that could help you to control your blood sugar. Instead of juice, try whole fruits, which contains fiber and will not spike your blood sugar as much as juice. Instead of white potatoes, try sweet potatoes. Instead of refined bread, which is processed, try 100% whole wheat bread. Instead of cereal with refined grains, try cereal with whole grains. Instead of yogurt with fruits combined, try yogurt with your own fruits added. Now, let us take a look at food labels. It is always important to read your food labels and be aware of what we're eating. Make note of the serving size per container. Many products have more than 1 servings per container. Look at the amount of calories in one single serving. In order to determine the number of calories per container, just multiply the calories in one serving by the total number of servings in the container. Look at the total fat and choose monounsaturated and polyunsaturated fat, and stay away from saturated fat and trans fat. These are no good for your heart. Look at the different types of carbohydrates on the package and choose high fiber products where possible. Try to choose products with less than 5% sodium and less than 5% saturated fat. Read through the list of ingredients on the package. Stay away from sugar, syrup, cornstarch, molasses, honey. Choose words like whole grain or whole wheat because they are high in fiber. The next 3 slides defines claims on certain food labels that is important to know. Example, the meaning of sugar-free, cholesterol-free, fat-free, and sodium-free. It is important to note that they are not 100% sugar-free, etc. Let us look at ideas for shopping at the grocery store. It is important to plan your meals in advance and bring a detailed shopping list so that you will know exactly what you intend to purchase. Spend more time around the perimeter of the grocery store where you will find fresh fruits and vegetables, meat and fish. You may want to eat healthy snacks before going to the store, which will prevent you from doing impulse eating. Buy lots of fruits, greens, high fiber cereals, etc. Buy whole bread or whole wheat pasta and brown rice. Choose skimmed milk or evaporated milk, which has less saturated fat than condensed milk. Load up on lean meats and healthy snacks, example carrots, high fiber, low sugar granola bars. Take a walk through the vitamin and supplement aisle of your pharmacy or grocery store. Choose probiotics that may help prevent urinary tract infections and yeast infections, which are very common in diabetics. Use melatonin if you are having problems sleeping. Talk to your primary care prescriber about taking vitamin B12 and folic acid supplements if you take metformin for your diabetes. Ask your pharmacist about the immunizations that every diabetic person needs. These include your annual flu shot, your pneumonia shots, and hepatitis B shots. And lastly, keep safe and healthy and protect yourself from COVID-19, as this causes increased risk of severe illness in diabetics. Contact your primary care physician if you show signs of COVID-19, such as fever, dry cough, shortness of breath, and diarrhea. At Nolan's Family Pharmacy, our aim is to help you through your wellness journey. We offer A1C tests for only $29.99. It's pretty convenient if you are unable to make your doctor's appointment and just would like to be aware of your readings. We are also launching a partnership with Ideal Protein, which is a science-backed protocol to help you lose weight and lower your A1C and cholesterol. Call us at 336-905-8874 and ask for the pharmacist or wellness coach, and we will be able to help.